for being part of this struggle for years, for decades in some cases. I know this comes from a deep spiritual place, and we've been digging deep in that well to keep this going, and I know there have been some depressing turns in the struggle for getting universal health care and getting affordability across. I want to give a special shout out to everyone here from the Virginia Organizing Project who's here. Amazing grassroots group in my community that gives voice to those who are normally left out of the conversation. Such an important thing. We have in parts of my district 20% unemployment. We have incredibly high rates, lack of insurance. We see the problems of small towns, of big cities, but also rural communities. We see what our community health centers do. We see what our churches do. We do see what doctors and nurses do to make sure that we have access, but that's not enough. We need to make sure that this is affordable. And I don't know about you, but I came up here for the first time as an elected official last year because I wanted I wanted a health market that put patients ahead of profiteering. To support a bill that's a handout to some of the most powerful insurance lobbies in the country. I came here to stand up for patients and for people. That's what y'all have fought for. That's what this country deserves. And I don't want to do it on the backs of the middle class either. You know, we've got a lot of middle class folks in my district who can barely afford their health insurance. It's going up 15, 20, 25% a year just to cover their families. I have so many workers who come to me and they say, I can't even remember the last time I went in for an annual review and asked for a pay raise. I go in just to ask to hold on to the benefits that I had the previous year. Wouldn't it be nice if we got to a point that we were helping to bring those premiums down so people could go in and maybe ask for a raise instead at the end of the year? These are the places where we are close to a very exciting place, but we all know that there's a big struggle ahead during this conference process. We need to make affordability key. We need to make sure access is there. We need to make sure that there's the competition in this market that is going to put those patients ahead of profiteering. Thank you for being part of that. Thank you for being tireless in it, and good luck here in the days ahead.
And on behalf of District